Okay. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, GL Chapter 30A, Section 18, and Governor Healy's March 29th, 2023 revised order extending remote participation by all members in any meeting of a public body. This meeting of the Great Barrington Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the town's website at townofgb.org. For this meeting, members of the public who wish to listen to the meeting may do so in the following manner. See instructions at the top of the agenda. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. That being said, we will call the meeting to order with a roll call vote. Peter Stanton.
Aye.
Dr. Ruby Chang.
Aye.
And I am here as well, Michael Lanou. We don't have any meeting minutes to approve tonight. So we'll skip down to Board of Health questions and updates, if there are any. I don't have any.
I just had one question. I think I heard back from Peter and Ruby, but Michael, can you come in at some point tomorrow?
Yes.
Okay, great. We can nail down a time later, but be in the office all day.
Are you there the whole day or?
Yes.
Okay, I could probably come in midday around noonish or so.
Okay, great.
That'd work. All right. There nothing further on that item. Look for a motion to reopen the public hearing.
Make a motion to reopen the public hearing.
I second.
The roll call vote will be Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. Okay. Good evening, Mike.
Good evening.
And we have Mr. Dineski with us too this evening. So I believe we've all received a revised order and have looked at it. And we also received and reviewed the supporting documents, which is the attachment A. Sorry, that was escaping me for a moment. And we have that attached to the order as well, which is great. And I've read through it again, and everything looks pretty good to me. But if any of the other board members have any further comments, we can get right into it. Looks like all the additions that were made reflected what we talked about last meeting, which is great. Thanks for doing that, Mike and David.
It was purely a coincidence that they matched what you asked for. Going through my notes looked like a hieroglyphics, but I guess I get it all. So
I think so. So any further comment from the board? If there isn't, we can move into public comment. And I believe tonight we could conclude our public comment period unless something unforeseen occurs. Let's see. Look good to you, Peter and Ruby?
Yeah, I'm good. I don't know if Ruby has any questions.
I don't.
I'd like to just clarify the order that this will happen. So at this point, if under page 6, it says now therefore pursuant general law, blah, blah. And respondent is hereby ordered to appear before the board at its next regular meeting, September underline 2024. Upon reasonable notice thereof, special meeting convene in order to establish a timetable for retaining a water system operating consultant. So do we have a good idea when that will be?
You're talking about our next meeting date? If you are, I believe we talked about two weeks from the order going out, which would basically put us, I believe, our first Thursday, which is September 5th, which is about 2 weeks from today. And it is our normally scheduled meeting day, so that works as well. So
Does that provide enough time for the water company to do what it needs to do?
I believe so.
Because they are supposed to submit a work plan with date, milestones for compliance within 14 days of the issuance of this order. So if we're asking them to come back with a plan in 2 weeks, and then we have to and then we give them 14 days to submit a working plan and date milestone from compliance. They're going to need time to come back to us with, first of all, they have to come back with us with a person that could be an engineer of some sort that could help us determine where to get the sampling and how to go about doing that. And then we have to approve of that plan. So does that, do they need to come to us to say, I'm going to hire this person and this is going to be the plan ahead of our next meeting so that we can approve of what they're doing?
well, as I read the text, I believe it's saying that they have to come in at our next meeting to establish a timetable. So my understanding is they'd have to appear before us and lay out the plan for doing the things that we have required them to do.
Right.
Yep.
But,
So
but we have to approve of that plan, but
Yes.
then at the same time, we need to make sure we know what the plan is way ahead of time.
Right, I think it's just establishing a timetable, so we, at that point, we can set future meeting dates. And basically, that meeting, say it occurs on the 2 weeks, would be just to start the process. And we would lay out what we'd like to see for a timetable.
So in other words, what I would like to see is that they would have presented us with who they're going to use for engineer consultant, since we're not providing, we're not paying for that service, and how they're going to do the testing. For us to review, we have to take a couple days to review it, and then on September 5th, we vote on it.
You'd like to see that, or that's
I
your?
like to see that because we're getting toward the warmer days. So obviously there's a good chance that the water color may change by the time the cooler days come. And that's number one. Number two is that I like to really get a sense of what the plan is before we vote on it, which means we need a couple days to review exactly what the plan calls for, who they're going to use for engineer, what does that site engineer recommend for testing purposes, and so that we have it all planned out for the next meeting in 2 weeks.
Well, we could ask them, require them to come before us in 1 week's time from now in order to set a timetable, and at that meeting, we can say we want to see a plan worked out in another whatever time period we'd like to specify. So it doesn't have to be 2 weeks from now, but I think,
Can I jump in?
yes.
I think
Please.
we have to leave at least 7 days for room for appeal of this order.
Right, yep. I was gonna say, this is all best case scenario.
And then further down, Ruby, I'm not sure if this is baked into your wishes, but further down, number 7 and 8 are ordering the respondent Housatonic Water to provide documentation to the Board of Health daily. And supply that documentation to the document on a daily basis and supply the Board of Health every 7 days with that documentation. And so I'm thinking if you meet at your regular scheduled meeting date on the 5th, you can establish a timetable for future meeting dates to have the respondent Housatonic Water come back before you, whether that's every 2 weeks or just following your regular meeting schedule every month. I can pull this order up too if you want me to screen share.
Sure.
Okay. Can you see that?
Yes. Yes, we can. Yep.
Maybe I just made it more confusing. I don't know.
So one question I had, it's more of a big picture question. I mean, the details that we're discussing right now they follow the line of if there was no appeal or no further contesting this order beyond that. But say there is an appeal and we move through that process and say still there's no agreement between the board and Housatonic Waterworks. What would a next step look like if there were to be such a step, or what happens? I mean, we've run into, of course, appeals on orders we've issued on different issues. Usually we can work them out, but assuming that there's substantial agreement or on some or all of this order, what would happen after that? I'm a little unclear what that process could look like.
Mr. Chair, if there were not agreement, there are a couple of things that procedurally could take place. The board could take legal action for enforcement of the order, and the company could also file an appeal under what's called the certiorari statute, which is a provision of law that allows for appeals of orders that are not necessarily subject to any statutory appeal provision. Those are the two most likely scenarios as I view the situation at present.
I see. And are those processes slow moving or how, generally speaking?
The appeal process is fairly circumscribed because what it involves is a review of the quote unquote record. And in the Superior Court, where it would likely be filed, there is a court standing order regarding the procedure and timing for submission of documents and then scheduling of hearings and issuance of a decision, although if there were an appeal, it would be a matter of months at least and not weeks, simply by virtue of the timetable that exists under the applicable provisions.
Okay. All right. Thank you for that. That answers my question. So Rebecca, you were saying we at least have to have a certain time period for appeal to our order under our normal processes. So do you feel that 2-week timetable is necessary? Or could we,
Yeah, I mean, if you want to have MAHB jump in here too, that's great, but I think at the very least, you know, the soonest timetable could be 14 days from now that you hold a regular scheduled meeting to talk about further enforcement of this order.
I would predict, and David, correct me if you think I'm overstepping or incorrect, but I would predict that in light of the order that you have for them to produce 1.5 gallons of water per person per day to the households, and in light of the cost that's going to incur for the company, I would predict that you're going to have within 7 days of this order either an appeal or an injunction, because the fine that's attached to that is $1,000 per day per household. So assuming even if it's only 100 houses that they're not supplying water to, they're on the hook for $100,000 a day. So I think that you're going to see some very quick action, I'm predicting, guessing, on the part of the water company to either stop this from happening or to come before you with an appeal and try to see if they can strike some sort of a middle ground with you. And David, tell me if that all makes sense or doesn't, but I'm just kind of looking at past experiences.
Nothing you said is out of what I might anticipate either.
okay. So it seems like we should, as the language of the order reads, we should keep that the same or not alter it and simply put the September 5th as the date where they need to appear before us first. That would give time for the appeal process and posting of agendas for meetings and such. Would you agree with that, Mike? We should just keep the 2-week?
Yeah, I think that again, subject to David, I think that you would probably you always have the option of an emergency meeting with less than 48 hours, and if there was a court action that this triggered, that would certainly, I believe, pass muster with the open meeting law as far as postings go, and you'd be in an emergency situation because you'd be needing to talk to your attorney in a hurry, and you'd need to do that in an executive session.
Just to add, in my view, that the timing that's set up in the order as presented, including, as has been discussed, the designation of September 5 as the meeting for review is appropriate. And I would recommend keeping that sequence as presented.
Okay.
And then number 11, it says respondent will be completed within 24 hours set vote of the Board of Health on August 15th. That should be the today's
Oh.
date, right?
That's correct. Yeah. Make sure that gets corrected, Rebecca.
I can correct that. Thank you.
I don't have any other questions.
Okay. So you're okay with proceeding as it's written in section 6 then?
Yes.
Great. Okay. Well, not hearing any more comments or questions for the board. I propose we open public comment for tonight, and I think we can, this would be our last session of public comment. As I said, unless something unforeseen comes up. So we will now take public comment. Raise your hand. We'll take them in the order that we see them. And we have a 3-minute time allowance for each comment. Please state your name and address. And
Deborah Herman.
just a
I'm sorry, I
reminder,
didn't mean to
that's
interrupt.
okay. That's okay. And just a reminder, all questions directed to the chair. So with that being said, go ahead, Deborah, you're up first.
373 North Plain. I just want to congratulate you on taking this step. And I just also want to say that, you know, I have been involved in legal wranglings with Housatonic Water. And at least my feeling is that they will fight this, you know, to the death. So I wish you the best of luck and courage. And we thank you. The people of Housatonic thank you. That's all I have to say.
Okay, thank you for your comment. Is there anyone else who would like to speak this evening? I'm not seeing any hands up.
There's another one.
Oh, I'm on the wrong tab, I think. Or maybe I just don't. Oh, there they go. Okay. Who's up next, Rebecca? Who did you see?
Michelle Loubert.
Okay, perfect. Michelle, you're up next. You should be good to go.
Okay, can you hear me?
You can.
All right, Michelle Loubert, 70 Division Street. I missed the last meeting, but I watched the recording of it on CTSB TV, and I've been attending other meetings regarding Housatonic Water. And if I'm not mistaken, one thing that hasn't come up, I've brought it up a couple times, is Berkshire Meadows as Housatonic Water Works customer. This is a healthcare facility. If you go to their website, they say they have a capacity of 35 clients there. It's a nursing facility.
We might have lost you, Michelle. Your signal's a little weak tonight.
And work there. The Board of Health ever reached out to Berkshire Meadows? I'm sorry.
Oh, I'm sorry, we lost you there for a minute. Your connection was a little fragmented.
Yeah, here in Housatonic, it usually is. Are you hearing me now?
We are.
Okay. I don't know where I cut off. I'm just curious whether the Board of Health has reached out to Berkshire Meadows at all. Who saw that business is a Housatonic Works customer as well. And being a healthcare facility, like I said, it's one thing for me as a private homeowner, but we do have a healthcare facility on Housatonic Water. And I did a little research going online with the EPA, and from what I can tell, the standards are bumped up quite a bit when you're dealing with your public utility and you're dealing with a healthcare facility. For example, one thing I came across was always have to work with the healthcare facility. So I'm just curious. Can you still hear me?
We can. It's a little bit choppy. We're hearing in and out,
Can you
but
still hear me, Michael?
I can at the moment, but you've kind of going in and out here.
Yeah,
But I believe your question is,
okay.
have we reached out to them or heard anything from them? Rebecca, I don't believe we've heard anything specifically for them, and up to this point, we've just been collecting or receiving complaints. We haven't taken
Well,
any.
I'm just really concerned because I have brought it up at various meetings, not all with the Board of Health, and it seems to get passed aside, and this is a healthcare facility.
Yes, point taken.
And like I said, I have gone online. I'm sorry, we keep losing the connection, Michael.
Yes, we do. And that's time. So as we move forward in this process, I'm sure we will be looking into who and how we reach out to people. We certainly have a number of complaints to follow up on, so we'll take that and put that on our list as well.
And also on your order, about providing water to customers, how would that work with a facility like that or a business on Housatonic Water?
Well, these are all the things that will work out once we have our first meeting with the water company and we establish a timetable and a plan for all the conditions of our order.
Okay, and I'll just close with this comment. If this was impacting Fairview Hospital, I think that would elevate the urgency in it. So I just want to point this out. There is a medical facility just in my neighborhood on Housatonic Water. So if I am having dirty water, I'm sure they are as well.
Okay, great. Thank you for your comment, Michelle. Okay. Next up, I believe. Was,
Yeah, Andrew Barron's next.
Andrew Barron's next. Very good.
Hi, thanks. Andrew Behrens, Houstonic. I just want to thank you for taking this bold and definitive steps to correct a longstanding problem. I was just wondering, I know Mr. Mercer, there were a couple of things that came up in the last meeting, like monthly manganese testing, and I'm just wondering if you guys have requested to see those yet, because I don't believe that they're available publicly. I don't believe that they were submitted to the docket in the rate case. And then also, have there been any efforts to get any asbestos testing? Because 13% of the pipes are asbestos cement, and there was a comment in AECOM engineering report that they were worried that there could be some contamination from asbestos, which is hypothesized to be a carcinogen. Yeah, and I think what Michelle was trying to say was just that my sense was she was trying to say that for a hospital or healthcare facility, the regulations are a lot higher and stricter for contaminants, and just wondering if you guys are considering that in the way you're going about measuring these things, since the water does serve a healthcare facility.
I can answer the first two questions that Mr. Behrens has. Number
Sure.
one is that I had spoken with Andrew Kelly, who is the chair of Mass DEP Western office this afternoon, and I had asked about the monthly manganese testing that were received by the DEP, and he said that if there were any out-of-bound values, that the Board of Health would have received citations, and we have not received any citations. So I assume that to be that the levels were within what they perceive it as reasonable, or whatever their levels they use for citations. Number two is I asked about the asbestos testing that is recommended by the DEP. We have 3.8% of our pipes in Housatonic Waterworks, according to the ACOM report that was done June 29th, 2021. That says it's 3.8%. And I could not find the asbestos testing report that was submitted to the DEP. And I requested that from the DEP, and they'll get it to me, hopefully by tomorrow. So that hopefully will answer the first two of your questions. I do agree that Berkshire Meadows is definitely a health facility that requires more attention. I don't know whether they have any facilities or they're aware of their water quality and has already put in filtration systems that would be more appropriate for their water. I believe there must be laws governing the facilities as far as to what requirements they need for their patients.
Okay, and then just one other thing I thought about. He also made some comments about the private mains and the dead end mains, and we've been tracking where the complaints of discolored water come in. And it doesn't appear to correlate with those dead end roads or those private mains. So I don't know, what data he's looking at to make that assertion, but I think that needs to also be looked at. Apparently, Stockbridge has not had the same problems with discolored water, and they've been replacing their mains. The town, I believe, is actually responsible for replacing the mains. So it really just starts to point more to, the mains in the Housatonic Water Works system, which go back to the 1800s, according to that ECOM report. And I think it was 13.8% were asbestos cement. It was a pretty significant number. I know it was over 10%.
I can speak to that issue with the healthcare facilities. Under the Safe Drinking Water Act, the EPA puts a burden. It wouldn't be on Housatonic. It would be on the nursing facility. It's on healthcare facilities to have systems in place to either monitor, detect, treat the issue of Legionella bacteria, which is the Legionnaire's bacteria. And also there's an obligation for them to have a water management plan in place if they know that they're dealing with a suspect water supply, and that there is an obligation of point of, I guess they call it point of use filtration, if I'm remembering the term correctly. So it's actually, the onus is not on Housatonic Water Works to be doing that under the Safe Drinking Water Act.
Okay. And then just one other thing, there's a proposition to connect the two water companies to serve as a backup for Great Barrington. Just wondering, if there's still issues with the Housatonic Water, what would the Board of Health's position be about connecting those two systems, potentially contaminating the Great Barrington Fire District water?
Well, I think at this point, I wouldn't want to make any comments on that till we move further along in this process. But I'm sure we would have comments to make when and if that was proposed.
Okay, thanks again for everything you guys are doing.
One other thing that came to mind, some comments from last meeting seem to indicate that our department received testing results from DEP, but as Ruby alluded to, and just to follow up on, we don't get regular testing results unless there's a non-compliance issue. So that's the only results that the actual hard numbers that we are sent from DEP is when there's an issue or issue of non-compliance. If everything is quote unquote in compliance, we don't see any of those numbers. Am I correct in stating that, Rebecca?
Correct.
Yes. Okay, good. I just wanted to put that out there because I know there was a little bit of confusion on that. Okay, anyone else who would like to speak this evening? I'm not seeing any other hands up at the moment. There's another. James, Great Barrington citizen. You'll be up next.
Good evening, the Board of Health. This is James Garzone, 84 North Plain Road. Again, just want to mimic what everybody is saying. Thank you for stepping in and making this finally happen for our residents. The only request I make is that I hope, we know that the Housatonic Waterworks is going to litigate. They already inferred that in the last meeting. So I hope our legal counsel, Mr. Dineski, is ready to fight vigorously and to make sure that whatever action you take will be enforced, because we have seen in the actions of the Housatonic Waterworks that they continue to deny and point fingers rather than take care of the issue. So that's all I have to say. Thank you.
Great, thank you for your comment. My one comment on that would be that the town manager and the select board have both communicated that they stand behind us, ready to provide us with the resources we need to take this as far as we can. Which I agree in echoing your sentiment that it's to the full implementation of this order. Is there anyone else who'd like to speak tonight? All right, not seeing any other hands. I will take that as an indication. There are no more comments. Let's get back to the agenda. So seeing no more comments, I'll look for a motion to conclude public comment on this order.
I make a motion to conclude public comment on this order.
I second.
And for a roll call will be Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. Any further or last comments from the Board of Health before we look for a motion? Seems we're all in agreement on the wording of this order. And if that's the case, I'll look for a motion to close the public hearing.
I make a motion to close the public hearing.
I second.
And for a roll call vote will be Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. And with that, I'll look for a motion to approve this order.
I make a motion to approve this order.
Mr. Chair, may I offer supplement to that, and then the mover
please.
may simply say so moved. I'd recommend that the motion be to adopt the order to be issued to Housatonic Waterworks Company as presented to this meeting, and to insert on page 6 as the date of the board's next regular meeting, the date of September 5, and to correct the date in paragraph numbered 11 from August 15 to August 22.
Great, thanks for the reminder.
So moved.
And we just need a second.
I second.
And our roll call will be Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. The order is approved. Next on the agenda tonight is citizen speak time. If there's anyone who has any final comments or would like to address the board on any issue related, Board of Health related, please raise your hand and we'll hear from you. And that includes any media questions as well. I see one question from Eileen at the newsletter.
I'm just confirming that you're going to send the order.
Yes, Yes, we are.
Tonight, maybe?
We have to get signatures on it, so I believe Rebecca will go out tomorrow.
You mean have the order issued? Or
Yeah.
send it to the public? I think Eileen means send it out to her.
Yeah,
Oh,
I can assume that you'll sign it since you voted to do so.
yes. Okay, I'm sorry.
I don't know. It's a public document, but
As soon as possible.
think it's possible.
Thanks.
Yes.
Yeah.
Okay, any further comments? Shaw Isaacson from the Berkshire Edge is up next.
Where did Shaw go? Disappeared.
Oh, he's right there, down three down.
Okay.
Yeah, the list moves around.
Good evening, Shaw Isaacson, managing editor at Berkshire Edge. Actually, the same question Eileen had was I sent you an email, Rebecca, requesting a copy of the order, if it's all possible.
Got that 1 minute ago. Thank you, Shaw.
Okay, I appreciate it. Thank you.
All right, thank you for your comment. Marine Q is up next. Go ahead, Maureen.
Hi, Maureen Quigley, 7 Depot Street. I just want to say thank you, and thank you. All of your hard work and dedication is so appreciated. And I just want to say we can't be more thankful to you guys for really pulling together and getting this done. So thank you again.
Okay, thank you for your comment. Anyone else tonight? Well, in the last few moments before we adjourn for the evening, many thanks to you, Mike, and to you, David, for your assistance and help on this order. It's much appreciated from our board, and I know the affected citizens in Great Barrington.
You're
And
welcome.
I see
You're
one.
very welcome.
Yes, thank you very much. One final hand is up. Rudy and or Joyce Pierce.
Hi, it's Joyce Pierce.
Okay.
Hi, I was, felt a little nervous to speak up, but just wanted to ask. I live on Hart Street in Housatonic, and I have neighbors to either side of me that have colored water, discolored water, but ours is clear, knock on wood, so far. And I just wanted to ask whether we would be able to make any comments or ask questions at that September 5th meeting, or whether that's just going to be you guys and Housatonic Waterworks is supposed to appear. Maybe you don't know yet.
Well, standard practice is anything item that we vote on, if there's public comment, we hear that. And of course, there's always public comment period at the end of every meeting.
Okay.
So I believe that there at least be one opportunity to weigh in. even
Okay.
make a
Great.
statement.
I'm kind of new to all this, and appreciating learning from you guys how this all works. And thank you for your service to our community.
All right, thank you for your comment.
I'm thinking that for the next couple agendas, this topic might be arranged in a public hearing fashion. So unless I get advised differently, I think that's how this will be set up on the agendas. So there's a specific time allotment for folks to speak on this particular issue.
Okay. That would make sense. All right, so one final call for any comment this evening. And seeing none, thank you again Mike and David, and I'll look for a motion to adjourn tonight's meeting.
I make a motion to adjourn tonight's meeting.
I second.
Our final roll call will be Peter,
Aye.
Ruby,
I.
and I vote aye as well. Great, thank you all, and have a good evening.
Thank you.
Hey,